About the Medical Watch, bullying healthcare workers.
Our medical reporter Dina Baer has the latest on a growing problem.
From the start of this pandemic, we relied on well-respected pulmonologists, epidemiologists, and infectious disease specialists to help us navigate the novel coronavirus. As time went on, one doctor told us she could not appear on the air for a while because she was getting such caustic backlash on social media. In addition to working countless hours in the COVID ICU and caring for patients and their families amid the massive death toll, this physician was enduring the stress of bullying. Now a new study shows, sadly, she was not alone.
It's gotten a lot more aggressive and a lot more noticeable and just more common in the last year.
Dr. Shika Jain is a UI Health blood and cancer doctor, but she knew her responsibility went beyond her field in the pandemic.
I tried to cover a lot of topics, things that people had questions on, things that my patients would ask or my family or friends would ask. I would try to communicate it in an easy to understand way so that people would be able to go to their own doctors with informed questions.
And as the pandemic wore on, Dr. Jain's message expanded.
You know, the things that I was posting, I would tell people to wear a mask, or I would recommend that they stay home to try to stay safe. A lot of people are very appreciative. I've gotten a lot of positive feedback as well. But what I've found is this past year, I've had more and more people attacking me, not just my messaging, but attacking me personally.
Dr. Jain posted a lighthearted tweet about working from home. The responses were rapid and cruel. One saying they get to laugh at effing morons like her.
And this asshat at Shika Jain MD.
The name-calling included political and sexual insults.
What a bunch of lazy, sloppy, liberal pigs. A socialist dream. Take a shower, put on a skirt, some makeup, and a killer pair of heels and own the day. All of these SUV driving, White Claw drinking, work from home types want to finger wag at you about wearing a mask because of their privileged positions.
In her mind, she's not driven by privilege, instead responsibility.
I'm very proud of the work that myself and my colleagues have been able to do in this space to try to get information out.
Social media activity was encouraged by healthcare organizations, especially with the threat of a new and deadly virus looming. But Northwestern, University of Chicago, and UI Health looked more closely at the result and found a troubling trend.
1 in 4 men and 1 in 4 women reported personal attacks.
The study in the Journal of the American Medical Association predates the pandemic and documents various types of harassment. Topical attacks were common regarding vaccines, gun control, and smoking. People lashed out at medical professionals personally about their race and religion, and they were sexually harassed, including threats of rape.
Not at all surprisingly, we found that women were much more likely to be sexually harassed. I think it was 1 in 6 women were sexually harassed versus only about 1 to 2% of men who reported sexual harassment, which is honestly, thankfully lower than I expected, but obviously far too high.
It's just really scary, when you're a student and just trying to do good work.
Trisha Pendergrass is a second-year Northwestern medical student who helps collect PPE for frontline healthcare workers and those in nursing homes and homeless shelters.
We definitely received some emails and some posts on social media of people who were angry and belligerent about us sort of being involved in what became a very polarized topic, which was mask wearing.
There were threats of exposing the volunteers' personal information and locations, but facing the venom has only emboldened her efforts.
If anything, it's made me more passionate about doing this work. As groups of physicians, as institutions, as employers, we need to plan for that harassment when it happens so we're able to support trainees, able to support minoritized individuals who are physicians. Because what we can't have is losing those voices from social media.
Doctors say if they had isolated their research to strictly cover the pandemic, they believe the incidence of harassment would be even higher. Back to you.